Pam, are you here? Okay, I don't see her. Dr. Sixto Caro. I'm sorry, I don't see. I have a list in front of me. Dr. Joel Foreman.
Here.
Very good. Hello. Rosa Maria Gil. I believe is absent, according to the notes I was given. Dr. Sidney Hankerson.
Here.
Dr. Mitch Katz.
I'm here.
Dr. Simona Kwan.
Simona Kwan's here.
Very good. Hello. Gail Nailwith.
Here.
Karen Redlener.
I'm here.
And Dr. Lynn Richardson.
Here.
Okay, thank you so much. Appreciate that. I'll start with a few remarks and then we have a lot to cover, so move quickly. Extremely proud and optimistic about 2023 and proud about how this city and this agency and our partners have responded to a whole host of crises, whether it is the triple-demic of respiratory viruses that have moved through our city during this winter, and obviously that we've been battling for several years now. The asylum seeker crisis that continues to grow in our city, and that so many agencies are responding admirably to across this city, with the expressed goal of giving dignity to everyone who arrives at our borders. And proud of how we've responded to the Dobbs Supreme Court decision to ensure and expand abortion access here in New York City. So I wanted to take a few minutes just to talk a little bit about that last subject, because we haven't really had a time to update you on the progress we've made as a city on that front. As soon as Dobbs came down, we immediately launched a communications campaign to make sure it was known that abortion was is safe and legal here in New York City. Following this, this past fall, we launched an abortion access hub call line where anyone from New York or beyond can call and get an appointment with a provider in New York City. And we've continued to see an increase in calls, with our monthly average for January more than double the average from prior months since its launch in November. And we're seeing calls from all over the United States, especially obviously from states that have restrictive laws around abortion. We've also heard a lot of positive feedback regarding the value of this service from the provider community, which are often operating in silos without the ability to talk to one another or to share data or to share information. The city has played and the health department has played a real convening role, and this abortion access hub has played a really important role in quarterbacking the system. And I think that that's been a really beneficial thing for clients and for providers alike. Just 3 weeks ago, we began providing medication abortion at the Morrisania Sexual Health Clinic in the Bronx, the first city health department to do so in the country, building off of access to medication abortion in our public hospital system. And we expand to 3 other clinics across the city by the end of the year. And so I just want to say I'm grateful to all of the teams across our agency and all of our partners across our city for working so hard to get these services off the ground, to our navigators and clinic staff who are supporting people daily. We've served a lot of people in a short amount of time operating both services, and I really look forward to New York City continuing to be a leader in sexual and reproductive health now and into the future. So those are my remarks. And with that, let's move into the approval of the minutes from the October 25th, 2022 meeting. Are there any corrections to the minutes? Dr. Foreman?
Yeah, hi, sorry, I'm on a different computer, so I was looking for where the hand raising is. I sent in a few corrections, 2 of which were substantive. I thought I would mention briefly. On page 17, line 21, there was a statement that said there is identified threshold for safe level of lead, and I think it should have been no identified threshold for a safe level of lead. And on page 33, I'm referring to 13 to 17-year-olds who had received 2 COVID-19 vaccines. It said maybe 2% having completed their primary series. I'm sure it's 50-something%, but I can't parse that data out of the city's data, but I'm sure it wasn't 2. So that probably should get updated. And that's it.
Thank you so much. So corrected, and appreciate those flags. They're important ones.
Actually, I think I read the updated minutes.
Yes, they have been, yes. Dr.
Already
Foreman, thank
fixed. You
you.
guys are
And they
fast.
have been sent around with reflecting Dr. Foreman's correction. So thank you.
Yeah, I think it's 82% as opposed to
Yes.
maybe 2%. Right.
Okay, if there are no further corrections to the minutes from the October 25th meeting, can I have a motion to approve the minutes as distributed and amended?
So moved.
Second,
Second.
all those in favor?
Aye.
Aye.
Okay, any opposed? Very good. The minutes from the October 25th meeting are approved as distributed and amended. Okay, let's move on to the items on our agenda. We have a couple. First topic on the agenda is a notice to adopt amendments to Article 207 of the New York City Health Code regarding corrections to birth certificates. Our presenter is Dr. Gretchen Van Wy, Assistant Commissioner and City Registrar within the Bureau of Vital Statistics in the Division of Epidemiology at the New York City Health Department. I'll turn this meeting over to Dr. Van Wy now.
Thank you, Commissioner, and thank you, Board. I'm glad to be with you here today. So what I'll be talking about first is what we proposed in October. So just as a reminder, on October 25th, we had proposed for publication amendment to Section 20701, which would allow government social services agencies to submit an application to correct the first name of a minor in their custody when there's not actual legal guardianship. Next slide, please. So we propose to add the following language to subsection A of 20701 to add essentially that an agency could, a city agency or an agency in accordance with the subdivision E could submit an application for the correction of a very limited portion of the birth certificate. The next slide. And then we added this subsection, which says that when a court of competent jurisdiction has remanded or placed a child into the care and custody of the Administration for Children's Services or an unauthorized government social services agency outside the city of New York, responsible for the welfare of a child, such agency may make an application for a correction of a first name when none or a placeholder was provided on the original birth certificate. Next slide. This was approved for publication and published in the New York City Record on November 4th. We had a public hearing on December 6th. Nobody presented at the meeting and no to provide comments. We did receive 2 written comments, but they were responsive to the proposed amendment. We also did receive comments from the board that were also resolved really about ensuring that documentary evidence was provided in these circumstances, which it is. It's also provided for in the health code, and also just to make sure that this was clear that this was when kids were already in the custody of a foster care agency. Next slide, please. Therefore, today we propose an adoption of the proposed amendment to Article 207.
Okay, very good. Thank you, Gretchen. At this time, we'll take some questions from the board, if any.
Lynn.
Yes.
Oh, Lynn, I see your hand now. Thanks. Dr. Richard.
Yes, thank you. Could you just put the proposed wording back up for a moment? It looked more like something that might have been like a cut and paste situation. Yeah, keep going back, please.
Previous part, okay.
Yeah, the first one. Yeah, so that final corrected portion, or by an agency in accordance with subdivision E of this section, or by a person if such person is under 18 years of age or over. Is that or over supposed to be there?
So that's, I'm sorry, in the brackets means redacting, so we remove.
I'm sorry. Okay, so that's so this will apply to persons under 18. Very
Correct.
good. Okay, thank you.
Dr. Foreman?
Dr. Foreman?
I would just move to approve.
Very good. Yeah. Can I have a motion to approve Article 207 of the New York City Health Code? Very good. A vote from each member.
Aye.
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 Very good. I vote to approve, and with a unanimous vote in favor of the motion carries. Very good. Next item on the agenda is the proposal to amend Article 203 of the New York City Health Code regarding protection of confidential medical information for spontaneous terminations of pregnancy. Again, our presenter is Dr. Gretchen Van Wy, and I will turn the meeting over to Dr. Van Wy.
Thank you. So today I'm here to propose, to introduce a proposed amendment to Article 203. A little bit of background. So termination of pregnancy is defined in the health code as the expulsion or extraction of a conceptus, regardless of the duration of pregnancy, other than a live birth. It includes fetal death. So this is something in the health code. And also in the health code are two definitions within this. One is the definition for what we call ITOP, but what is commonly referred to as an abortion, and a stop, which is also what's commonly referred to as a miscarriage. And so just I'll be using that language interchangeably throughout the presentation. So section 20303A of the health code requires that all of these terminations of pregnancy be reported to us at the health department. Next slide, please. So a little bit more background. So of course, in Dobbs versus Jackson, the Supreme Court overruled Roe v. Wade and Planned Parenthood versus Casey. So this eliminated the constitutional right to abortion and gave individual states the full power to regulate abortion. And as a result, abortions have been banned in 12 states and severely restricted in other states. Next slide, please. What that means is that the new legal landscape has made a confusing situation for healthcare providers vis-a-vis miscarriages or spontaneous terminations of pregnancy. And these are just some headlines talking about that. So in different jurisdictions where, the treatment for a miscarriage, the follow-up care was not clear, and potentially put women in jeopardy. Next slide, please. So, as the commissioner has mentioned, in anticipation of Dobbs, the ruling, the state and the city took legislative action to protect abortion patients and those helping patients access abortions in New York City and in New York State. The laws prohibit the courts and county clerks here from issuing subpoenas in connection with out-of-state proceedings related to abortion. They also prohibit state and local law enforcement agencies from cooperating with or providing information regarding abortions lawfully performed here in New York. And they prohibit the use of city resources to provide information about any person associated with an abortion that has been lawfully performed. Next slide, please. So the current text of Article 203 doesn't, when we looked back at it, under careful review, we determined that it does not provide the same level of protection for confidential medical information about spontaneous terminations, like stops or miscarriages, as is provided for induced terminations or abortions. So that's why I'm here today to propose amending Article 203 of the Health Code around terminations of pregnancy. Next slide, please. So 20307C requires that the certificate of induced termination of pregnancy or abortion be confidential and not subject to compelled disclosure or to inspection by persons other than the commissioner or authorized personnel of the department. 20307A actually offers less protection to confidential medical reports of stops or miscarriages because it allows compelled disclosure of records. Next slide, please. The lesser protections afforded to stops or miscarriages are not in sync with the recently enacted state and city laws. And it's therefore possible that an out-of-state law enforcement agency could actually try to access the stop records of an out-of-state resident who had a procedure performed here in order to commit an action against an alleged illegal abortion under that state's laws. Next slide, please. So for that reason, the department proposes amending Health Code Section 20307 to afford both induced and spontaneous terminations of pregnancy the same level of protection, and to allow the department to assess any subpoenas or other requests for stop records to determine whether the underlying use is permitted by state and city law. Next slide, please. So the proposed text would read as follows. First, the heading. So 20307, the header would read, confidential medical report of spontaneous termination of pregnancy and certificate of induced termination of pregnancy, not subject to inspection. So we're striking that compelled disclosure phrase. We're a little concerned about the way that was stated, so we're striking that. And then in section A, we're adding text. And we're removing text as well. So the confidential medical report of the spontaneous termination of pregnancy and the certificate of induced termination of pregnancy shall be confidential and not subject to disclosure or to inspection by persons other than the commissioner or authorized personnel of the department. We're striking the next portion. And then we go on to say that the commissioner or the commissioner's designee may, however, approve the inspection by others of such medical reports and certificates for scientific or lawful purposes. We'll keep the next section, which we'll read within the context of this section. Scientific purposes shall mean epidemiologic surveillance, an investigation by a governmental public health agency, research, or the compilation of statistics relating factors bearing on disease incidence, prevalence, and mortality or treatment. And then we'll strike that last piece because we've addressed it in the previous section A. Next slide, please. So therefore, I ask for the board to approve the proposed amendment to Article 203 for publication in the city record for public comment. I'm happy to take any questions.
Am I muted?
You are, Pam. Go ahead. Go ahead.
Let me just say that I was so pleased to see this, and am, of course, 100% in favor of this, and would like to move that we approve this resolution to publish these proposed changes. It is how many states do you have any information about of the states that allow abortions? Do we know just offhand how many of them have laws that protect patient confidentiality?
Well,
I mean,
that's
I'm sorry, it's not states anyway, it's cities. I lost myself here. But
no, I don't have at my fingertips and it's sort of, you know, vital records versus other confidential patient information. I don't have it at my fingertips.
Yeah.
I'll hold your motion for a minute, Pam, and come back to it.
Someone actually seconded it in the press of.
I see. I think there may be questions. Also, I'll go to Karen first.
Thank you. I was just wondering about the state laws relative to this. Is this amendment consistent with what they have in place or plan to have in place? Just wondering about the alignment.
No, that's something that we haven't spoken to the state about, but we do know the state in the spirit of the broader set of laws protecting the right to access abortion. This is consistent with those broader state laws.
Interesting. And have there been situations where people have looked into spontaneous abortions as a way to get access to information about, an induced abortion? Is that something that has happened?
So yes, yes, so there have been women who've presented at emergency departments having miscarriages, who've been accused of trying to give themselves abortions. And this is really what that's trying to protect those women from.
I see. Well, I am totally in support of this as well.
Dr. Foreman, I see your hand is up.
Yeah, thank you. I'm also completely in support of this. But I did want to ask a question because, and this comes from my lack of legal background, but there's a disclaimer kind of line at the end, if you go back to the text, that to me sounds a little broad. And although I have great confidence in our Department of Health and you, Commissioner Vossen, it says that the commissioner could disclose this for, quote, lawful purposes, without defining a little bit better what they mean by lawful. Our laws, New York City, New York State. What if a commissioner who might not agree with what we are thinking said, well, it is lawful in the state that is requesting it, therefore this is a lawful purpose and I will disclose. So I just wondered, again, if someone could educate me about that wording and whether that is a little bit hazardous.
Good question, Dr. Foreman. I'll kick it to our general counsel, Lisa Landau, and anyone else.
Sorry, thanks, Dr. Foreman. It does give some amount of discretion to the commissioner, but of course it's cabined by lawful purpose. So I understand it's the commissioner in consultation with counsel, and I hear you're raising this as a possible concern. I guess it showcases that the commissioner, may well have reason, after consultation with counsel and to provide the information if perhaps there was a reason to look into a particular, practice. I think it's, I think we left it there, to give flexibility, but we could think more about that. But I think that was the reason that it's in there.
Yeah, I understand that perspective, and I have great confidence in the people making these decisions and determinations now, but things change sometimes. And I wonder if there is some way to word it that might restrict the definition of lawful to things that are lawful in our city and state as opposed to in other places.
Or if I could just add, or some mechanism that would sign off on the commissioner's decision in some way other than the commissioner.
I like Joel's idea of making it, if specifying it's New York state law or New York City law, if that's possible.
Suppose you could suggest that it would require approval by the board.
Well, this is just going out for comment, so.
Right, we're just proposing it for publication.
Yeah.
At this point. Yep.
Yeah, the board's comments could be taken into account by the department in
That's
terms of changes that might be made before a final proposal comes to us.
I think that's a good idea. That's a good idea. Thank you, Dr. Richardson.
Yes, very good. So we're approving this for publication, and I had a motion to approve for publication from Pam Breyer. Do I have a second?
Second.
And all in favor?
Aye.
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 I vote to approve as well. And so with a unanimous vote in favor of the motion carries. Thank you very much. And our next topic on the agenda, I believe it's our final topic, is notice to modify COVID-19 vaccination requirements. Our presenter is Dr. Celia Quinn, Deputy Commissioner within the Division of Disease Control at the Health Department. I'll turn the meeting over now to Dr. Quinn.
Hello, thank you very much, Commissioner, and I'm very happy to be here with all of you. It's nice to see the board. So I will give a bit of background on this topic. So between August and December of 2021, the Commissioner of Health issued a series of orders that require members of the public and private sector workforce to submit proof of being fully vaccinated against COVID-19. And that means having completed the primary vaccination series. These orders also required the exclusion of workers that failed to submit that proof of vaccination. The orders initially focused on higher risk settings and populations like residential congregate settings, childcare programs, and schools. And ultimately, over that period of time, the orders were extended to cover the entire public and private workforce in New York City. Next slide. These orders were necessary to address the high level of COVID-19 transmission within communities that at the time are caused in part by the emergence of new and more infectious variants. To protect workers and the public, including those who were too young to be vaccinated. And as to the city workforce and contracted with entities, it was to ensure the continued functioning of city programs. Next slide. The COVID landscape, fortunately, has changed since 2021. The number of cases, hospitalizations, and deaths have remained relatively stable over the past months without the dramatic peak that we saw during the winter of 2021 into 2022. We now have COVID-19s that are available for everyone ages 6 months and older. And there are updated bivalent booster doses that are widely available and are currently recommended to provide broader protection against the COVID-19 variants that are currently circulating. And studies have shown that high vaccination rates correlate with lower rates of hospitalization and death. Next slide. Also, vaccine coverage is high in New York City. COVID-19 primary series vaccination rates are high among working age New Yorkers. 99% of adults ages 18 and older have received at least one dose of a COVID-19 vaccine, and 90% have completed the primary series as of late January this year. And COVID-19 vaccination rates are especially high among the city workforce. 96% of citywide headcount, excluding health and hospitals, have shown proof of completing their primary series, and 99% of Department of Education employees had shown proof of completing the primary series. Next slide. This slide is busy. There's a lot of information on it, so I won't go into great detail, but this is just illustrating the impact of a variety of policy interventions that contributed to our achieving COVID-19 vaccine campaign milestones during the same period of time, early July 2021 until February of 2022, including several of the orders I just mentioned. Next slide. So given the high rate of vaccination in New York City, infection-acquired immunity, and relatively stable COVID rates, exclusion of unvaccinated workers is not necessary for public health at this time. The removal of the vaccination requirement is aligned with other recent policy changes that includes an easing of mask requirements, ending quarantine requirements, and then rescinding the private sector staff vaccination requirement in New York City. This happened last fall. Next slide. On October 25th, 2022, that is when the Board of Health rescinded the requirement for COVID-19 vaccination in non-governmental workplaces. So the orders that currently remain in effect that require proof of vaccination are for members of the city workforce, for contractors and other entities that work with the city, for non-public schools, childcare and early intervention program staff, and for visitors to Department of Education school buildings. Next slide. So this is the list of the current orders where changes are being requested. One is the order to require COVID-19 vaccination for city employees and certain city contractors. This was implemented in October 2021. The second is the order to require COVID-19 vaccination for Department of Education employees, contractors, visitors, and others. This was implemented September 2021. Also an order to require COVID-19 vaccination for individuals working at certain childcare programs, also from September 2021. There's also an order to require COVID-19 vaccination and face coverings in childcare and early intervention programs that was implemented in November 2021 and then modified to remove the face covering requirement in August of 2022. And lastly, an order to require COVID-19 vaccination for non-public school staff, and that one is from December of 2021. Next slide. So we'll now review the series of proposals that we're suggesting. The first is to amend the order to require COVID-19 vaccination for city employees and certain city contractors as follows. The amendment will end the exclusion of certain city employees who fail to provide proof of vaccination as required, and to no longer require certain contractors of city agencies to require their covered employees to provide that proof of vaccination. Next slide.
Okay, thank you so much, Dr. Quinn. At this time, we'll take questions from the board on proposal number 1. I see no hands or questions. Okay, can I have a motion to approve the order to amend the requirement to require COVID-19 vaccination for city employees and employees of certain city contractors?
So moved.
Can I have a second?
Second.
Good. And all in favor?
Aye.
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 Any opposed?
Oh.
Okay, I vote to approve, and with the unanimous vote in favor of the motion carries. I will now turn it back over to Dr. Quinn for a description of the second proposal.
Yes, thank you. So the second proposal is to amend the order to require COVID-19 vaccination for Department of Education employees, contractors, visitors, and others to remove the requirement that these following individuals provide proof of vaccination: Department of Education staff, city employees, charter school staff, and staff of contractors who work in Department of Education schools or buildings, and visitors to Department of Education school buildings, and also seeking to remove the remote participation in school meetings provision for unvaccinated individuals. Next slide.
Thank you, Dr. Quinn. May I have a motion to approve the order amending COVID-19 vaccination requirements for Department of Education employees, contractors, visitors, and others?
So moved.
Second,
Sorry, I have a question.
of course.
Sorry, my internet is a little bit unstable. Is there a possibility that we can separate out some of these, the repeal and amendments? Because I know that you're talking about repealing the requirement for new DOE staff and repealing the requirement for staff of any charter schools, and then to amend the requirement for DOE staff and city employees who work in person. Is there a possibility to separate out some of those for the vote?
Can you
Maybe
say
I'll
more,
ask-
Dr. Kwan, for what purpose? Or what's behind your question?
I would like to discuss further the repeal of the requirement for new DOE staff and new city employees of the DOE to provide proof of vaccination.
Guess I could maybe offer maybe a little bit of clarification. Actually, there's a mayoral order that affects city employees that speaks to city employees, future employees, and that includes future DOE employees as well. And it was actually passed by the mayor and is being rescinded as of tomorrow. So that is with respect to future employees, city employees. So I'm not sure if that seems, Dr. Kwan, to be your concern, is the future employees, and maybe wanting to discuss that, maybe that removal, but in the end, that it actually is the mayor's order that affects all the future employees. So I know it's a little bit of a checkered situation, but that's actually sort of the description of the landscape.
And so that does not require a board vote.
That's right. For the future employees, that was governed by the mayoral orders.
Thanks, Lisa. Dr. Foreman, you have your hand up?
Yeah, thank you, Commissioner. I guess I just wanted to say that still I'm terribly grateful for the department, commissioner, for instituting these orders when they were in that time, and that it saved countless lives without a doubt. But I do also think that the situation is clearly changing rapidly and for the better. And with any luck, it looks like we'll be entering a time when COVID is a seasonal infection with peaks, but will become not so dissimilar from other infectious diseases that we deal with in the workforce and the schools and everywhere else. So I support the rescinding and the modification of those orders. I also had a question related to it, which is that for employees of the city, I don't believe that the city requires vaccination for anything for employment. I don't think that's a requirement. And so COVID is becoming like all of these other things, unless I'm wrong about that. And so I'd be curious if that's true, but I don't believe to be a city employee, even a Department of Health employee, that you have to be that you need to demonstrate vaccinations in order to be employed.
There are some limited exceptions. In early child care settings, we do have an influenza mandate, an influenza vaccine mandate. Of course, in healthcare settings, public and private, we have multiple vaccination mandates, but a lot of that is governed by state, which regulates healthcare facilities, not by the city. So you are indeed correct that there's only very limited situations in where vaccines are explicitly required to be a part of the city workforce.
Certainly circumstances might change. We could be facing a different variant or another illness, but barring that sort of an unexpected event, this seems like the right and reasonable step. I'll raise it at the end, but I wanted to ask about requirements for school children, and maybe I'll come back to that later. I know that's a complicated and separate issue.
Thank you. Yeah, I'm happy to discuss further. So I'll just repeat. May I have a motion to approve the order amending COVID-19 vaccination requirements for DOE employees, contractors, visitors, and others, please?
So moved.
Second?
Second.
All in favor?
Aye.
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 I,
Any against?
Against?
Okay, thank you. With one vote against and the remainder in favor, the motion carries. And now we will turn back to Dr. Quinn on the third and the last proposal.
Yes, this is the final proposal. So this one is to rescind the following commissioners' orders. The first one, the order to require COVID-19 vaccination for individuals working at certain childcare programs. The second, the order to require COVID-19 vaccination and face coverings in childcare and early intervention programs, noting that the face covering element of that requirement has already been modified and rescinded. And the third, to require COVID-19 vaccination for non-public school staff. So the proposal is to rescind those three.
Thank you, Dr. Quinn. And again, we'll take questions from the board on this proposal, if any. If no questions, can I have a motion to approve the order rescinding orders requiring COVID-19 vaccination in childcare and early intervention programs for non-public school staff and for individuals working in certain childcare programs?
So moved.
May I have a second?
Second.
Thank you, and I'll take a vote from each member. Everyone, and all in favor? Apologies.
Aye.
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 Any dissents? Okay, very good. I vote to approve, and with the unanimous vote in favor of the motion carries. And that brings us to the close of our meeting. Thank you. We got through a lot in a short amount of time. I want to thank you all, as ever, as we continue to take steps to protect the health and welfare of New York City. Thank you again for making yourselves available. I wish everyone health and safety. The meeting is adjourned. Thank you.
Thank you.
Dr. Hassan, could I ask it that maybe we could discuss the process?
Apologies, Dr. Foreman. I know you had a question. I apologize.
We don't need to
Sure.
discuss it now. I know everyone's time is short, but I was hoping that we could talk about the process by which adding COVID-19 vaccination requirements to school children at various ages might be considered going forward. I know that California and DC have considered it, although I realize they both delayed it. And one of the big issues was full FDA approval, which we only have for Pfizer 12 and up. But that will change. And, the considerations of risk benefit at different ages, I think, are very important. I don't fully understand them all and haven't thought them all through, but I think the board should think about that. And I'm sure the department is and would love to discuss that at a future meeting, anticipating where we'll be for the next school year or the year after, and when this may or may not become part of the routine vaccine requirements for school.
Thanks, Dr. Foreman. You're raising important questions. You flagged one important issue, which is FDA approval and full FDA approval. As you know, most vaccines, both for children and for adults, and during the COVID emergency, came through on emergency use authorization, and progressively, we hope we'll get full FDA licensing, but that's not the case just yet. Number two is just the issue of the state being the typical regulator of most childhood vaccinations in schools and school requirements. And so, being in close partnership with and contact with our colleagues at the state to ensure that there's alignment. Those are all factors that we're weighing amongst other things, but very glad to discuss this further with the board at the appropriate time.
Thank you so much.
Okay, meeting is adjourned. Thank you so much.
Bye-bye.
Goodbye, everyone.
Thank you, everyone.
Thank you.